the legal ego. Yeah, this mic's not working, so we're just going to talk loud. So for those of you who are not derms, I do a monthly column in Dermatology Times called Legal Eagle. Yeah, we have no mic. It's okay. We're loud, right? In which I present hypotheticals, often related to cases I've seen, and just how to deal with them, because, as you all know, attorneys can be pretty difficult. So, all right, so I'm going to start off really dealing with legal issues. And what I'm going to do is try to make you comfortable with how attorneys think. And if you can think like an attorney, it's going to lessen the likelihood of being sued. But more than that, it's going to make it so that it's not likely you're going to lose a lawsuit. You know, it's easy to file a lawsuit in the United States. You know, you just get some attorney who thinks there's some money, and we've talked among ourselves about all these people out there, these plaintiffs. You know, the world has really become pretty crazy, and they get crazier and crazier, so people sue. And so you can't really stop yourself from being sued, but you can stop yourself from losing a lawsuit if you follow basic principles. And I taught healthcare law at New York's Fordham Law School for 20 years. And the concepts I'm going to present to you took 14 weeks for me to teach law students. You will get them in about 5 minutes. And that's not to imply that lawyers are not as smart as doctors, but we pick up things a little bit quicker. So let's go through this. Absolutely no relevant disclosures on this one except for the fact that I'm an attorney. So I could talk for an entire day on different legal issues in medicine, but I'm going to focus on the most common problem we all face in practice, and that's malpractice based on negligence. And so what are the things that can happen? What do you have to have in a consent form? The things that can happen can include erythema following energy-based device technologies. And I'm going to focus in on lasers and energy-based device technology because, you know, we're at the ASLMS meeting. Yeah, we need this microphone on. Thank you. And so the things that can happen, obviously, are erythema, redness after treatment, pigmentation issues, infections, and scarring. And so the expected things, and this is what should be, there we go, we're on. The expected things should be an informed consent, not that they're ever going to lead to a lawsuit, but it's how you build better communication with your patients. And so erythema and hyperpigmentation, you know, we've all seen it from so many different devices. It generally goes away, but it's something that should be in a consent form. And so you can see on the right there, I guess it's not up on that screen, it's on this screen. On the right, you can see somebody following pulsed-dye laser treatment. You can see the purpura, and on the left, there was a treatment there, and there's some post-inflammatory hyperpigmentation. If you don't inform someone about this, they're going to be upset with you, and that can lead to its own issues. But if you inform them about it, it's going to go away, and they know about it, and it's really not going to be an issue. And again, this is following IPL, and these are a dime a dozen. IPLs are everywhere. It's the most commonly sold device to the med spa industry, but by and large, hyperpigmentation goes away. Here's someone who really should not have been treated with a Q-switch Nd:YAG 532 frequency double laser because of her darker skin. She was treated for some freckles on her skin, some ephelids. She got hyperpigmentation. She's really unhappy. She actually came to me because she was unhappy because this had been done to her, actually by a physician. But in the end, it goes away. And so, you know, the inappropriate device was used. We'll get to the concepts of duty, breach of duty, causation and damages. But the fact is she was upset, but it's going to go away. The real issues are unexpected things. And, you know, whether you've informed somebody about this, and that's infection, scarring, and then hypopigmentation, which generally can last a lot longer than hyperpigmentation following procedures, and sometimes can be permanent. So let's start thinking like an attorney. Legal analysis, infections, scarring, and hypopigmentation. These are the 4 elements in a cause of action for malpractice, for negligence. Duty, breach of duty, causation, damages. Duty simply means that I do this the way most of our peers do it. If you do it the way most of your peers do it, then you are practicing in accordance with the standard duty. The problem is a lot of us try to push the envelope a little bit, and pushing a little bit still can fit within the duty, but if you push it too far, you've breached that duty. And once you breach that duty, then something goes wrong, then the question is going to be, is there a connection between the breach of the duty and some sort of damages? So that connection is causation. And damages in our arena, by and large, is scarring. and there's an economic value to a scar. And that economic value often is based on what the person does in life, their age. Someone who perhaps is 85 years old, the economic damages, and it's really looked at, purely fiscally. The economic damages that you've caused to an 85-year-old over the course of the rest of their life is small. The economic damages, if you cause a scar on the face of somebody who's 25 years old, is obviously going to be a lot bigger. So did we practice in accordance with the reasonable duty? That is what our peers do. If we didn't, we breached that duty, and then there's got to be a connection between the breach and then some sort of damages, which I said is usually scarring. If you look at these lawsuits, they throw in all kinds of other things. The sensation is not right, and I love them when it's always in there. They can no longer have sex. No matter what you do to them, they can't have sex anymore. It's always in these lawsuits. But by and large, the only one that's taken seriously by juries is economic value. So infections, duty, breach of duty, causation, damages. So here's someone that so many years ago, must be 25 plus years ago, I treated with laser hair removal. I actually forgot to ask her if she had a history of herpetic cold sores. She broke out with this thing, so I actually breached my duty because you have to ask people about this. But there is no damage, right? Because this is going to go away. She has this thing for a week, and that's the end of it. So, yeah, breached my duty. And my duty should have been to ask, but there's got to be a connection between that and damages, and there are no damages. Here's someone treated with, in the old days, a full-field CO2 laser, too aggressively done. There was a breach of the duty. The parameters were way off the wall. This is going to lead to scarring. Here, there is a connection to damages. There's an economic value to that. So breach of duty, causation, damages. So let's talk about scarring. Again, it's the same 4 elements. Everything you do. I mean, this really applies to your homes. If you don't get rid of the snow on a snowy day, it's the same thing in the office. It's always duty, breach of duty, causation, damages. It's hard to believe that in this day you could have this kind of scarring. I was speaking to Jill Wybell in the speaker ready room. She's going to put together a pretty large journal related to complications and how we try to stop this stuff and all the stuff that's going out there. And I do train a lot of extenders, a lot of PAs, a lot of nurses. We have them in the practice now. I run a meeting that trains them. The ones that are well trained do a good job, but there are these med spas out there that have terrible people doing terrible things, and this is what you end up seeing. Clearly, we've got damages here at this permanent scarring. This was done by an ophthalmologist in New Jersey who was treating somebody with an Nd:YAG laser for spider veins, which we all have done, but forgot to turn on the cooling. And so you can't use Nd:YAG lasers to treat these things without cooling. And so where's the breach? The breach was no cooling. What is the connection between the breach and what happened? You can see the scar. Is there an economic value to that scar? There is. So duty, breach of duty, causation, damages. And this, I've kind of thrown some of the PAs and nurses under the bus. Now I'm going to throw some of the doctors under the bus. This is a plastic surgeon in New York City who used a CO2 laser on someone's back for acne scarring, went very aggressively, contended that he had given the patient a consent form to sign, and the patient had signed the consent form which said that there could be scarring. So he contended he practiced in accordance with the standard of care because he gave a consent form warning about scarring. Problem is the parameters used on the laser were totally inappropriate. So there's the breach. So there can be multiple different breaches. You have to give consent. If you give consent but you do things all wrong, there's still a breach. And what is the damage here? This is going to be permanent scarring. Before I joined with Brian, we're part of private equity dermatology in New York. I had my own office 2 blocks away from where we are now, Brian. And so on 57th Street in Manhattan, I was on the 7th floor. I used the light shear laser at this time. This was probably 20 years ago for hair removal. And on the 1st floor of our building, there was a med spa. And in New York, if you don't know this, in New York State, laser hair removal is not considered the practice of medicine. So there was a spa on the 1st floor of our building that had the exact same device that I had. They had high school kids performing laser hair removal. Obviously, I couldn't compete with that because I would charge $200 for an upper lip with this laser. They charged $50 for the upper lip. And they used an Nd:YAG laser in this case, and they used an 810 nanometer in this case, both of them. I'm going to show you pictures of both, and both of them, they didn't turn on the cooling. You can see that whitening. If you get that kind of whitening when you treat someone with laser hair removal, First thing that happens is you pee in your pants, and the second thing you should do is call an attorney, because you know where that's going to go. And this is the terrible scarring that occurred. So duty, breach of duty, causation, damages. And by the way, when people perform these treatments, even though this was done by a high school kid, the contention was you can't hold them to the same standard of care as you hold us to, and that is not true. They actually are held to the same standard of care. And so I said one was 810, the other one was 1064. Here's 1064 nanometers, no cooling, really high fluences. You get that kind of whitening, breach of duty, and we've got the damages because of the scarring. I love showing this case. This is a case that I lectured in Toronto so many years ago. This is a case that was presented there. This is the ex-wife at that time of a physician who had an IPL, we always tell it's IPL because it's the rectangle, in the office. He treated his wife for I'm not sure what, caused this kind of scarring. And so the issue was not so much whether it was duty, breach of duty, causation, damages. She contended that he assaulted her with battery because he wanted to divorce her. So I don't know where this one went, but so be it. This is a case that I presented at this meeting probably about 20 plus years ago. And I presented this case because it was someone that I had done laser hair removal on, I had done. We were doing a lot of sculpting of eyebrows 25 years ago. And I treated this lady on a Friday. I got a call on Saturday night. I was at some affair with my wife. And she got through to me and she said, something's wrong with my eye. She said, I looked at my eye in the mirror, and she said, the circles of my eye are no longer circles, it looks like a teardrop. And she said, my vision's blurry. And I thought she was nuts. It's just another New York City crazy patient. And I said to her, I don't know what to say. Come to the office on Monday, I'll take a look at you. And when we treated her, and again, this was 810 nanometer, she had definitely eye protection, gauze pads, eye shields, all that stuff. She comes to the office on Monday, and sure enough, her iris is no longer circular. There's like a teardrop shape to it. And I have no idea what this is all about. And so I said, go see an ophthalmologist. She goes to an optometrist, not an ophthalmologist. The optometrist gives her a drop. She comes back a few days later. It's not any better. I said, I told you to go to an ophthalmologist. She goes to an ophthalmologist. And the ophthalmologist tells her that she has iritis and uveitis. And she said, and the ophthalmologist said to her, it must have been because whoever was treating you put too much pressure on your eyeball, protecting your eye, while you're being treated for your eyebrows. And I thought about who was helping me at the time, and my medical assistant was like this 90-pound young woman. I mean, there was just no way. I said, it can't be. And her response to me was, you doctors are all the same, you lie, lie, lie. She said, I'm gonna find an attorney and I'm gonna sue you. And this was, I guess I was probably in law school at the time. And I said, okay, it is what it is. So sure enough, 3 months later, they want the records. And so I went and called what I thought were the experts at the time. I called Rox, and I said, Rox, what's this all about? And Rox Anderson said, I have no idea, I never heard of such a thing. I called Suzanne Kilmer, who became a lifelong friend of mine because she was a fellow when I was doing my stuff. Nobody ever heard of it. So I presented at this meeting, where she ended up with this uveitis, iritis, and didn't make any sense. It turns out, if you look at that eyebrow, look at all the chromophore there, all the pigment that she's got. Despite the fact that we gave her appropriate eye protection, there's so much in terms of energy being delivered to those hairs. Those packets of energies, those photons went underneath her skin and hit her pigmented iris. This probably wouldn't happen in a blue-eyed individual, but it happened to her. And it happened, and so I caused this. The problem is there is no duty, breach of duty, causation, damages if something has never been described before. And I presented at this meeting and no one knew what I was talking about. This has now been well described countless times over the years. So now there is a duty not to treat eyebrows. Some people do treat unibrows, some don't, but you can't treat eyebrows. You really can't. And if you do, it's a breach of duty. At the time, it was not known, and if it's not known at the time, you don't breach duty. And you can tell by her left eye, her left iris, that is not a circle to that pupil. She's got a little teardrop shape. And there again, you can see it there. Hypopigmentation, duty, breach of duty, causation, damages. And so this is someone that had laser hair removal done. They often get a little erythema after treatment, no big deal. And then 3 days later, this happened. And that happened because she had gone and gotten a lot of sun exposure a few days before the treatment. She really wasn't all that tanned. And so the duty now is to ask people before you do laser hair removal on them in sun-exposed areas, have you had recent sun exposure? It's a problem when you live in places like Florida, because obviously people get sun all the time. But she got that hypopigmentation, really unhappy, sued. But by and large, hypopigmentation, if you wait long enough, it goes away. And invariably, these lawsuits, by the time they get to court, which is always 2 years later, there's pretty much nothing there. Here again, so you have hypopigmentation on the right following CO2 laser resurfacing, and on the left following erbium YAG laser resurfacing. It can happen, but usually goes away. So the last one I'm going to show is something that I've now seen 2 cases of, and they both came out of the med spa industry, and this is where a misdiagnosis. So here's someone who had laser hair removal done for a very hairy chin, a woman, and there was a misdiagnosis. She also had acne, she had some male pattern thinning, and her voice was getting deeper. What do you think happened here? What was going on here? This was totally missed. So she had a pituitary tumor. I've seen it twice already. And you got to think about this stuff. You know, people come with bizarre things, but it's been reported. So she had increased muscle mass, decreased breast size. She had lost her periods. And so she's got hirsutism. And so, you know, that's not typical excess hair, but at least you have to think about it. And if you don't, when someone comes in with that, it could be argued you breach the duty. So duty, breach of duty, causation, damages. That's all you have to remember, 4 elements. And if you think like that every day, you're still going to get sued, but you're not going to lose a lawsuit.